Hello students, welcome back to Pharmaceutics 1 lectures. We will discuss about semi-solid dosage forms, which is a unit 5 of Pharmaceutics 1. These are the contents which we are going to discuss: definition, classification of ointments as well as ointment bases, factors affecting the drug penetration, preparation of ointments, excipients used in semi-solid dosage forms, and evaluation of the dosage forms. Now, what are semi-solid dosage forms? Semi-solid dosage forms are the topical dosage forms used for therapeutic action, protective effect, and even for cosmetic function. That means these are the semi-solid dosage forms which can be used for therapeutic action, for protective effect, and even for cosmetic function. And generally it is applied to the skin, nasal cavity, vagina, and rectal cavity. What are the examples of semi-solid dosage forms? The examples of semi-solid dosage forms includes ointments, paste, creams, gels, and rigid foams. All these comes under semi-solid dosage forms. So try to remember the examples of semi-solid. Includes ointments, paste, creams, gels, and rigid foams. Now, what are the advantages of this particular semi-solid dosage forms? The main advantage of these dosage forms is that the probability of the side effects is reduced. There are no side effects. Okay, we can reduce the side effects. The main advantage is when the drugs are administered as semi-solid through topical route, first pass gut effect and hepatic metabolisms are avoided. First pass gut and hepatic metabolism is avoided. We can have local action as well site specific action of the drug. These are convenient dosage forms and can be used for unconscious patients or patients who have a difficulty in administration, oral administration. These are also suitable for bitter drugs. These are some of the advantages of semi-solid dosage forms. So try to remember few advantages like probability of side effects is less. They avoid first pass gut and hepatic metabolism. Local action and site specific action of the drug can be achieved. Mainly convenient for unconscious patients who have a difficulty in oral administration, and they are suitable for bitter drugs, for administration of bitter drugs. Now, what are the disadvantages? The main disadvantage is that accuracy can't be measured. Like say for example, we are using a tablet. So these are called as single unit dosage forms. We are going to take one tablet at a time. But here when it comes to the semi-solid dosage forms, we will take some amount as we like. There is no fixed dose here. Okay, there is no fixed dose of the drug when it comes to this particular semi-solid dosage forms. Okay, so accuracy can't be measured. And sometimes it may cause a staining of the medicament also. So that means some stain, some color is seen on the clothes if it is not washed, and if it is going to be stained for a long time. And they are very bulky to carry. Unlike the solid dosage forms, this is a single strip which we will carry. But this ointment, it is big in size and we need to carry with us. And other important side effect is contamination. Contamination of the product may happen during the application. Say for example, you are not washing your hands properly. Without washing the hands, if you apply, definitely there will be contamination. And when compared to the solid dosage forms, they are less stable because always there is a moisture, water present, and which is a very good source for microbial contamination. And they may also cause irritation or some allergy to some of the patients. Now, what are the ideal properties? How your semi-solid dosage form should be? Number one, it should have a smooth texture. You should feel it if an ointment is applied that there are no large particles or the rough particles. It should be something smooth, fine particles should be present. Elegance in appearance. Okay, if you see that, you need to feel that yes, this is very good and I can use it. And it is non-dehydrating. Okay, so that means when applied, it should not lose the water. Non-gritty, easy to remove, and it is not sticky, non-greasy, non-staining, and non-hygroscopic. These are all the ideal properties of your semi-solid dosage forms. Okay, now as I said, in the semi-solid form dosage form, there are various types like ointments, paste, gelates, rigid forms. Now, the first one what we will discuss is about the ointments. What are ointments? These are the formulations intended for external use where we are going to apply on skin or on mucous membrane. These are external dosage forms meant to apply on skin. These are external dosage forms. So where we are going to apply on the skin. And these ointments are two types, medicated ointments and non-medicated ointment. Medicated ointment means where there is a drug that is going to be present in the ointment and which will be giving you some local action or systemic effect. Non-medicated means where there is no drug. Okay, we will use for what is called as some cooling effect or as an emollient, like that. Now, apart from the drug, any formulation will definitely have an amount of drug. Okay, apart from the drug, these ointments mainly contain the ointment bases. Okay, so the important ingredient apart from the drug is ointment base. Now, what is this ointment base? It is that substance or a part of the ointment which serves as a carrier or a vehicle for the medicament. So what we will do, we take this drug and we will mix with our ointment base, and this you are going to apply on your skin. So since I can't take directly the drug and then apply onto the skin, what do? I mix the drug with the ointment base, make it as a very smooth cream, and this smooth ointment I will be applying onto the skin for local action or for systemic action. Okay, but one of the important point what you need to consider is the stability of the ointment. Okay, now there are some ideal properties of ointment bases which we need to discuss. How the ointment base should be. It should be inert. It should not give any action as such. Odorless, no smell, and it should have smooth texture. And it should be physically and chemically stable. Stability is an important criteria. So both physically and chemically it should be stable. And when combined with other ingredients, it should be compatible. There should be no incompatibility. It should not lead to any chemical incompatibility. It should be compatible. And when prepared, consistency should be maintained. That means it need to spread and smooth and softly when applied onto the skin with stress. And it should not produce any irritation or sensitization of the skin. So try to remember 3 to 4 ideal properties like inert, odorless, smooth, physically and chemically stable, compatible with all other ingredients. Consistency should be maintained so that it should spread easily onto the skin, and it should not produce as such any irritation or sensitization. Now, what are the different types of ointment bases? Ointment bases are classified into mainly 4 types. The 4 types includes oleogenous bases. I repeat, oleogenous bases, absorption bases which absorb water, emulsion bases which contain both oil in water or water in oil, or water-soluble bases. Very simple. Oleogenous means completely oil containing. Absorption means which absorb water. Emulsion which has both water and oil, and water-soluble bases which are dissolved in water. Okay, so these are the references book. In this video we have seen what are semi-solid dosage forms, what are the advantages, what are the various examples of the semi-solid dosage forms. In that we started the discussion on ointments, definition, advantages, ointment bases, ideal properties, and just started with the type. Thank you.